If you've ever had a urinary tract infection, you probably know when another one is coming on. Is it necessary for you to run straight to the doctor at the first signs of a UTI? Maybe not. So can you safely treat yourself before it becomes a full-blown infection and then save yourself some time and money? Maybe. By the end of this video, you will have the information that you need to know whether or not it's safe to treat yourself at the beginning of a urinary tract infection, or if it's time to see the doctor before it becomes worse. Good morning, health-minded people. I'm Dr. Snow, and over the years, I've helped many patients understand when it's safe to self-treat their condition at home and when it's time to see the physician. Urinary tract infections, or UTIs, are very common, especially in women. In fact, more than 40% of women will get a urinary tract infection in their lifetime, while only 12% of men will suffer this ailment. So, what is the best non-drug way to handle a urinary tract infection? It turns out that the best treatment is actually prevention. So, how do you prevent a UTI? Drink lots of water. Drinking 3 or more liters of water per day will help keep the bacteria flushed out of your kidneys and your bladder, preventing an infection. And yes, drinking a lot of water will increase your need to urinate. That's kind of the point. Other steps that you can take to prevent UTIs is don't sit in hot tubs and don't take bubble baths. Avoid tampons. Wipe front to back. Urinate after each intercourse. Avoid tight-fitting pants. And empty your bladder often. Did I mention drink lots of water? So, if you've been doing all of these preventative measures and you still think you're getting a urinary tract infection, what are the symptoms? In people under the age of 65, normal symptoms include burning with urination, the strong, urgent need to urinate again, even if you just went, passing frequent but very small amounts of urine, strong or foul-smelling urine, flank pain, which is pain in the small of the back, or pelvic pain. And if you see blood in your urine, it's time to see the doctor. Now, did you know that older adults may experience unusual symptoms of a urinary tract infection? Watch this video next so that you can understand what symptoms you should be looking for in your older mother or father. First, let me point out that if you have fever, chills, blood in the urine, nausea or vomiting, this is not something that you need to be treating at home, and it's time to see the doctor. But if you're sure of the symptoms and they are still mild, there are steps that you can take to avoid a visit to the physician. First, increase your water from 3 liters a day to 5 or 6 liters a day, and more if you can do it. You want to flush the bacteria out of your system as fast as possible. Cranberry juice and cranberry juice capsules have been recommended for years to treat and prevent UTIs. But do they really work? Maybe. As with many natural remedies, the information is conflicting. One study says, yes, it will help. The next study says, no, it doesn't help at all. Cranberries contain a substance called proanthocyanidins, or PACs, that prevent bacteria from sticking to the bladder wall. Cranberry juice cocktail contains way too little PACs to be of any help, and it has way too much sugar. 1 cup of cranberry juice cocktail contains 23 grams of sugar. That's 5.5 teaspoons full of sugar per cup of juice. Some studies show that whole cranberries may be a better option. 1.5 ounces of fresh or frozen whole cranberries taken daily may help prevent UTIs. Don't add sugar. Sugar can actually decrease your body's ability to fight off any kind of infection, including UTIs. If this video is providing you useful information, please hit that like button. Second of all, vitamin C may be helpful because it acidifies the urine, but you would have to take about 10 grams of vitamin C daily just to get the amount needed to help fight off the urinary tract infection. At this dose, you will get diarrhea. A third natural option is the use of D-mannose, which is a naturally occurring sugar. D-mannose has recently been investigated for the treatment and prevention of UTIs. In some studies, D-mannose has been as effective as the prescription antibiotic nitrofurantoin in preventing and treating urinary tract infections without the side effects of the medication. The dose studied to prevent UTIs is 1 gram twice daily. The dose of D-mannose to treat a urinary tract infection is 1.5 grams twice daily for 3 days, and then dropping to 1 gram twice daily for another 10 days. While D-mannose will cause less of a spike in blood glucose, it still is a sugar, and so diabetics should watch their blood sugar very carefully if they decide to try this treatment. If you choose to self-treat with any of these methods and you're not better within 3 days, or if your symptoms get worse within 24 hours, it's time to see the doctor. UTIs are nothing to mess around with. Left untreated or undertreated, UTIs can lead to sepsis or even death. If you catch it early and use one of the previously mentioned treatments and drink lots and lots of water, you may be able to avoid seeing the physician. But if you have any of the serious symptoms mentioned, drink a big glass of water and call your physician. If you found this information helpful, please press that like button and consider subscribing to my channel. Oh, and don't forget to hit that little bell so that you'll be notified every Monday when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. What is your favorite way of preventing UTIs? Comment below with what's worked for you. It might help somebody else. Thank you for joining me today to learn how to treat mild UTIs before they become serious. Stay healthy, drink your water, and have a blessed day.